Also this morning, Deputy Chief Medical Officer Dr. DeLon Brennan spoke to us about questions about a possible vaccination to surface soon for COVID-19.
For developing a vaccine is actually fairly involved. The good thing is that things have moved along because the science has moved along and definitely progressed in that to develop the actual vaccine, we were able to study the genetics of the virus or the bacteria or the organism that's causing it in a lot more detail. Obviously, with advanced analytics, with advanced molecular techniques, we can figure out what works for immunity, what part of the virus or the bacteria is able to cause the body to react and form antibodies in order to fight it off. And then we target those portions that are similar to other viruses that we've seen in the past so that we might be able to do it a little bit more effectively than would have been done, 20, 30, 40, 50 years ago. So what we're able to do is then move that into a stage where we can say, okay, we've developed what we think is going to be a safe product. So your first trials, when they refer to these phases of phase 1, phase 2, phase 3, and the like, the first part of that is really just making sure that it is safe, right? You're not worried about whether it works or not yet. You're just trying to make sure, if I inject this into someone, is it going to be safe? Are they going to have, a large amount of allergic reactions? Is it going to be an issue? Then you want to make sure the next trial, phase 2, is to make sure that it's actually effective. So you really want to make sure, does it actually cause someone to form antibodies that should address the issue if they were then later exposed to the real virus, that they would then have antibodies to be able to attack it and keep you from getting ill. After that, you then move into higher phases of trials, which are really more about, can we produce this on a large scale? And if we can produce it on a large scale and give it to a large amount of people, does it do that? Is it still safe? Is it still effective and giving us the antibody response? And if people are then exposed to the virus, do they then get ill? So that's kind of the process that they go through. And once they're able to show in these larger trials that it's safe, it's effective, it works on a large group of people without any untoward effects, then it can be released out to the public. Unfortunately, sometimes that can take up to a year, year and a half, 2 years before, from start to finish. But of course, as techniques have evolved, it's gotten a little bit better, it's gotten a little bit faster, and that's kind of what technology will help you to do. And I think, as people begin to fear this because it's going quickly, I think, we have to have a healthy fear, knowing that we have to make sure that things are done well so we don't set ourselves up for ill effects that happen later. But we should also celebrate that technology has gotten us to a place where we can move this a lot faster, and hopefully we'll be able to get to a point where we're able to keep millions, if not billions of people from getting ill due to coronavirus.